Hello everyone, I am Viji. My seminar topic is Bone Anchored Hearing Aids Mechanism and Applications. Introduction. The bone anchored hearing aid is an implantable hearing device that transmits sound via bone conduction rather than through the air. Unlike conventional hearing aids, which amplify sound and send it through the ear canal and middle ear, BAHA directly stimulates the cochlea by conducting vibrations through the skull bone. The principle is simple. Sound energy is converted into mechanical vibrations which are transmitted through bone to the functioning inner ear, effectively bypassing any blockage or damage in the outer or middle ear. This is the diagram of bone anchored hearing aid. External connector and sound processor is placed the implant, and then sound will enter into the bone, sound traveling through the bone and then enter through the cochlea to the eardrum. Principle of bone conduction. In normal hearing, sound waves enter through the external auditory canal, vibrate the tympanic membrane and pass through the ossicular chain to the cochlea, where they are converted into neural signals. This is known as air conduction. However, the skull bone itself is capable of transmitting sound vibrations directly to the cochlea. This is called bone conduction. When a bone vibrator is placed on the skull, it sends mechanical vibrations through the cranial bones. These vibrations move the perilimb inside the cochlea, stimulating the basilar membrane and hair cell. This is the principle of bone conductions. When the loudspeaker, the sound will enter into the bone, and the bone conduction transducer will conducted to the oral cartilage, temporal bone, cochlea. Then components of BAHA system: titanium implant, abutment or magnetic coupler, external sound processor. Titanium implant is surgically embedded into the temporal bone. Abutment coupler disconnect the external sound processor to the implant. External sound processor is the captures the environmental sounds through microphones, convert them into digital signals and amplifies them. This is the bone anchored hearing aid sound signal. And then mechanism of action: sound detection. The external processor picks up sound through a microphone. Signal processing: the device digital processor filters and amplifies sound to optimize clarity and volume. Vibration conversion: the processed sound is converted into mechanical vibrations by a transducer in the processor. Bone transmission and cochlear transmission. This is the mechanism of action of diagram. When the external device including microphone, the internal device including a signal processing module. Surgical procedure: site preparation, drilling and implant placement, healing and osseointegration, abutment or magnet attachment, processor fitting. Osseointegration. Osseointegration is the process by which living bone cell attach directly to the surface of a titanium implant without forming fibrous tissue. This concept, first described by Per Ingvar Brainmark, is crucial for the long-term success of BHA. Osseointegration typically requires 3 to 6 months. Indications for BAHA: conductive hearing loss, mixed hearing loss, single-sided deafness, and external middle ear malformations. Contraindications: poor bone quality or thin bone that cannot support osseointegration, active infection or skin disease at the implant site, poor hygiene or inability to maintain the device, previous radiation therapy to the temporal bone, unrealistic expectation regarding outcomes. Types of BAHA system: percutaneous system, transcutaneous system. Percutaneous system is the small abutment that passes through the skin. It provides direct connection between processor and implant. And transcutaneous system use internal and external magnets instead of a skin penetrating abutment. Advantages of BHA: bypasses damages ear structures, ideal for conductive or mixed hearing loss. These are the reversible procedure. Implant can be removed if not tolerated. Excellent speech recognition in noise, especially in single-sided deafness. Limitations and complications. Limitations are: cannot be used for profound sensorineural hearing loss. Requires surgery and follow-up care. Complications: pain or pressure under magnet, failure of osseointegration, skin infection, cosmetic dissatisfaction. Recent advances are digital signal processing, wireless connectivity, MRI compatibility, miniaturization, active bone conduction implants. Clinical outcomes are osseointegration success 90 to 95%, hearing improvement 20 to 30 dB gain in threshold, speech recognition up to 40% improvement in noisy environments. Patient satisfaction over 90% report improved quality of life and confidence. And conclusion, the bone anchored hearing aid is a transformative solution for patients with conductive or mixed hearing loss who cannot benefit from traditional aids. With advances in design, wireless technology, and surgical techniques, BAHA continues to offer safe, effective, and life changing hearing rehabilitation for both adults and children. Thank you.